Scotland has some of the best health databases in the world, with consolidated information on patients' use of health services, which is key to understanding whether treatments incorporated by the NHS are improving people's health. The ISD, the Information Services Division, part of the NHS, provides information on the use of health services by the population of Scotland, which makes it possible to plan health actions and services. Big data is the term that describes a huge volume of data, such as information about the prescription drugs in the NHS, with currently more than 1 billion records stored. The FAR Institute will then be responsible for integrating the NHS databases and enabling universities to conduct scientific research to find out what the best current treatments are. It works with big data in a research collaboration involving 21 academic institutions and health partners, funded by a consortium of 10 organizations, led by the Medical Research Council, which is committed to providing cutting-edge research to better understand the health of patients and populations. In Brazil, SICATS is the one who will seek to use this technology and explore its results. In partnership with the Department of Management and Incorporation of Health Technologies of the Ministry of Health and the Pan American Health Organization, SICATS developed a guideline to evaluate the performance of the technologies incorporated in SUS. This guideline proposes the use of real-world data provided by DataSUS, or observational studies, to evaluate the results of technologies incorporated in the unified health system. The results of these studies have the capacity to guide managers' decisions to improve the health of the population.
In Scotland, we have total capture of all medicines data from all our primary care. So every patient who comes into a doctor's surgery and then dispensed through a pharmacy is able to then re-record and collate that data nationally to have a national repository of all medicines used. Because we have a unique patient identifier, so everybody in Scotland has a unique patient identifier, we can link the data from their prescribing to their hospital activity data. So if I go into hospital, I can link what's happened to me in hospital, and also to lots of other data sets. So if I have cancer, then we can link to that. So what we're interested in here in our research is linking up the prescribing data to the other healthcare data, and potentially through to social care and education, to look at what's the actual benefits and risks of those medicines in our population in Scotland.
The major difference between Scotland and England is in England there is co-payment for medicines dispensed in the community. But that depends on whether you're working or not working, unemployed or elderly. So basically the adult working well will pay for their medicines. If you are elderly, if you're unemployed or if you're a student, then they're free of charge. So about 10 or 15% of the patients in England pay for their medicines. The other major difference is the assessment. So in England, it's the National Institute of NICE. They keep changing their names, so I just call them NICE at the moment. They used to look at a class of medicines, whether they should be funded or not funded. They now look much more at the single technology assessment, learning from Scotland that it's better to do single technology assessments rather than wait for a class of medicines to be on the market before doing an assessment. The other major difference is that Scotland much better at following up the effectiveness and safety of the medicines in practice than NICE is. Remember our visit to NICE when you came over before, and they were just thinking about assessing the medicines in practice, new medicines. Well, we do far more of that in Scotland than we do in England. Unfortunately, most people don't know about SMC, they know about NICE, so it's good that you're here so you can learn more about the Scottish system.
Eu gosto muito do SUS. Sempre que eu fui lá, fui bem atendida. A fila tem, muita. Tem que ter paciência, né?
Até um tempo atrás a gente tinha no posto remédios, agora você procura, não está tendo.
Os hospitais atendiam a gente ótimo e atende ainda. Agora só que para a gente chegar até o hospital não consegue internação.
I think the NHS is really great. Yeah, I really like it. Well, obviously it's free, which is really good. It means you're not reluctant to, go to the doctor if you have a problem. You're more likely to go. The bad points are the wait times are really, really long because so many people use it. Yeah, I think that's the main good or bad points.
We don't pay for it, although we have paid for it over the years. People that have worked, and I have worked for 50 years, so I'm quite happy with that. The treatment I get personally in the National Health Service has been excellent. I've had new joints replaced. I've never had a problem. I've had top of the range surgeons dealing with me, and if not them, I've had their associates who know as much as they should know. And I've got no problems at all. The only problem I do have with the National Health Service is sometimes the waiting, and sometimes the admin staff. They seem to not know what other people are thinking.
This trip showed us the similarities and differences that we have with the NHS of Scotland, and we returned to Brazil with the feeling that the exchange of experiences, besides enriching us, makes us learn with each other by improving the health of all.